ANMAtalks is an initiative for sharing knowledge between students, staff, and management of the Nordic and Baltic academies for higher music education and anyone else interested. Welcome to this 12th edition, ANMAtalks Exploring Norwegian Music Therapy.
We are very excited for today's session, where we are going to dive into the world of Norwegian music therapy. So this is a field that is really on the rise, especially in Norway right now. There's a lot of exciting research, and music therapy has even made it to national TV with a documentary called the Dementia Choir. And the music therapy program in Oslo also just scored really well on the national student survey, way above average. And since many music academies don't have a music therapy department, we thought it would be really interesting to hear a little bit generally about what this field is about and how it, as a pretty young discipline, fits into the conservatory context. So today we have something as rare as an all-Norwegian panel. And I will introduce you and you can wave maybe. We have Viggo Krüger, who is an associate professor at the Grieg Academy in Bergen. We have Johanna Engh, who is a master student at the Grieg Academy in Bergen. Wilhelmsen, a PhD candidate at the Norwegian Academy of Music in Oslo. And we have Gaute Kjølner Andersen, who is a master student at the Norwegian Academy of Music. So to start us off, I'm going to ask Viggo to give us just a brief explanation of what music therapy is.
Okay, in short, that is a bit difficult, but I will try. To begin with, music therapy, I guess, has been around as long as there has been human beings on the planet. It has been described in ancient times by Plato and Aristotle, and also in the Middle Ages. But it was after the Second World War that music therapy became an academic discipline. And that was because the soldiers came back from the war, excuse me, and the nurses realized that singing helped the soldiers overcome the traumatic incidents and the symptoms. Actually, they relaxed and they get the feeling of well-being when music came around. So music therapy was born as an academic discipline in the US in the 50s. In Norway, the first academic education program came in 1978 at the Norwegian Academy of Music, and in Bergen we had the first program in 2006. Music therapy as an academic discipline is a hybrid discipline, you could say. It's compounded with other disciplines such as psychology, medicine, musicology, and so on. But it also has its own kind of identity as a discipline. So there is theory and research that is music therapy. Today in Norway, the Health Directorate has made guidelines where they recommend music therapy for the treatment of, among other diagnoses, psychosis. This recommendation, which has a very high grade of evidence base, has made it possible to establish positions around the psychiatric units around, especially Bergen and Oslo. So today you will find music therapists in hospitals, institutions, working together with nurses, doctors, and other professionals. This creates a very interesting field for research. So today in Norway, music therapy is researched both in qualitative and quantitative research methods. Some of the researchers receive big grants, and one of those researchers is at the Norwegian Academy of Music, and one of those projects is behind this Dementia Choir, which you mentioned. So I would say that the Dementia Choir would not have reached the national TV like it has done without the research base behind. I guess you would agree on that, Christina. Would you say something about that, maybe?
No, of course, what we do as music therapists is founded in experience and research, and that's very important for the development of our profession.
Yeah, so it's very important to say that music therapy is evidence-based, practice-based, and it's a profession that is growing in Norway. We could say thanks to the research centers in Oslo and Bergen and the education programs at both places.
Great, thank you. And I would love to hear a little bit about how the two, because we have two different educations in Norway. And can you say a little bit about how they are organized? Maybe Viggo, you can say something about Bergen, and Christina about Oslo.
Yeah. We have two programs, and in Norway we like to say that if you are a music therapist, then you have a master degree in music therapy. That doesn't mean that other professions can use music in their work, but to call yourself a music therapist, we like to say that you have this education behind you. We are not a protected title, unfortunately. We are trying to become a protected profession with the title, but we are not there yet. Both the programs are working towards this goal. But as you say, in Bergen, the program is a 5-year integrated program where you start first year and you go through the program, and then you finished with a master degree, hopefully. While in Oslo, you have a different system where you come in with a base, for example, a bachelor or a nurse education. And then you have a 1-year music and health program. And then you enter the master program where you finish after 2 years. So these two models create different possibilities and challenges, of course. So it's very difficult to say what is the best model. I guess it's the two models are kind of it's good. I think in the end it's good that we actually have two models, because then the student can choose to go to Bergen or Oslo. Those who have a base of, for example, a teacher or nurse education before they start, they can choose to go to Oslo. And those who come straight from high school can come to our program, for example. But talking about the program in Bergen, 5-year program, which I know the best, the students get the chance to really build the identity as a music therapist during the 5-year program, because they are participating in a lot of activities. They have a wide range of practice placements during these 5 years. They meet a lot of music therapists, and I guess they meet more music therapists than they do in Oslo. Christina, you must say something else if this is wrong, but so if I should advocate the program in Bergen, for one thing, it is this kind of continuously professionally identity building that is going on during these 5 years. Of course, some of the students, they think it's a bit too much, and it's a challenge for us to give a rich program and to build this as a development from beginner to a master. But I think that's the strength of the program, that we actually have these 5 years to become a music therapist.
Christina, would you like to add something?
Yes, I could. I could talk a bit about the programs that we have in Oslo. As Viggo mentioned, we have 2 different programs here. We have Music and Health, which is a 1-year course on a bachelor level. That could include that when you enter this could be either a part of a free bachelor or a supplementary degree. But it's not a professional degree as music therapy is, but it's a 1-year course that focuses on music and health and how we can use music in different pedagogic and health contexts. So it's a very broad educational program. And would you like me to say a bit about what we focus on in the programs?
Yeah, maybe shortly.
Yeah. Well, we have different subjects on pedagogy and music and the brain and health and social theory. And we have many musical subjects where the students are develop themselves as musicians, concert production. We have 2 tours around in prison and in different health contexts. And we have composition and arranging, and we have voice training. And they also get training in chord instruments like piano or guitar or accordion. And they also have context with music therapists in this program, and music and health workers through 2 practicum periods where they visit once a week through the semester. They visit a person that works in healthcare or in pedagogical settings with music. And as Viggo also mentioned, to enter this program, you have to have 2 years of higher education. That could be, for example, like Viggo said, nurse or a teacher or a psychologist, or it's a very broad. Very many musicians also applied for the music and health program to get a bit of broader way of working, to get more knowledge. And then when you have passed the music and health program, you formally have the competence to apply for music therapy, and that's a master's degree that's over 2 years. So this is the professional degree that you get after you finish the master's. And the master's degree have 2 parts. We have one scientific part, which focuses on the academic part of music therapy and research and writing the master's thesis. And we have philosophy of science, we have scientific methods and academic writing. And also there's a practical part where we have more practical subjects like improvisation, therapeutic improvisation, and different techniques for this. And we have composition and arranging. And we also have a subject that's more about developing your identity as a music therapist, as Viggo also mentioned, they have in Bergen. And these subjects, the practical subjects, are very important also. So these 2 parallel parts are equally important. And of course, the musical parts, where our way of working is we use music, and we are musicians who work with people. And we meet people in very vulnerable situations in all ages. So we have to have a very broad knowledge about people and how music affects us in different ways, both the positive parts and the potential that lies in musical interaction between people and the interaction between music and the person. But also we have to have knowledge about the risks that the power of music implies, which is and music is a powerful tool. So we have to know a lot about how the risks in using music. So the master's degree, I think I can say both in Bergen and in Oslo, focuses a lot on these things.
Thank you. Great. So as we heard, these programs are very different, and I guess they also recruit people from different stages of life and career. And I would love to hear from the students on the panel, really what brought you to apply for music therapy, and maybe you can say something about what kind of visions you have for your professional life when you graduate. Gaute, would you like to start?
Yes, thank you. So I'm a bit older student, and I wasn't straight from high school, so Bergen wasn't an option for me. So I had also done some musicology and worked a little bit. So for me, the model that is in Oslo was perfect, really. It allowed me to become a music therapist in 3 years, which was perfect, really. So that was my why I wanted to study at Oslo, really. So why I wanted to study music therapy and become a music therapist, it's a complex and personal question, of course, but I had many experiences in my working life where I used music myself, being a musician, and I saw the joy and the health potentials, really, which I've come to understand more fully from an academic perspective later. So I guess I had many strong experiences with music, with people, that led me to want to pursue this further professionally and academically. So yeah.
Great. Johanna?
I grew up in Tromsø, way in the north of Norway, right? There are like practically very few music therapists in the north of Norway. So I had never heard about music therapy except for books from the US or short documentaries from the US, which I thought was interesting, but I didn't think that it was an option to do it in Norway at all. But I was doing a lot of music and I was interested in people. So I was considering studying something like psychology that had something to do with people. But I couldn't give up on music. That was something I couldn't let go, right? It was impossible, which I'm sure like many of you can relate to maybe. So then I went to a school near Oslo, and they talked about music therapy and music and health as a subject. I took a subject at that school. It was Toneheim, if that says anything to people. And they talked about the program in Bergen. And then it was done. I had to do this. It was decided.
Thank you.
Yeah.
So I've also been a student at the Norwegian Academy of Music in Oslo, and I really have the impression in Music and Health, this pre-master program for music therapy, that the majority of the students come from a music background. So it says that you can either have a Bachelor of Health or a Bachelor of Music. Is this a correct impression that I have? And also, what do you think about the fact that maybe not so many are recruited from the health side than the music side? Anyone who would like to answer?
Yeah, I think you're right, and it varies through the years. I know how many we recruit who have background as musicians, and how many some years there are more than one nurse and more than one teacher, so it varies, but I think you're right. And the last couple of years we've had a voluntary subject for the performative students that's called Introduction to Music Therapy, and we know that some of the students there have decided to to apply for music and health after doing that subject. So I think you're right. We do recruit a lot of musicians and also music students from the Academy, Norwegian Academy of Music.
In Bergen, I think it's a bit different because we recruit musicians, yes, but also people that has not so much background in music. At least they are not professionals or very high-skilled musicians, but they are very interested in working with the people, and they have background working at hospices and kindergartens and schools, and they just want to explore this potential of using music further in that direction. So yeah, one interesting thing that happened in Bergen a couple of years ago was that we got a lot of rock musicians from the music scene directly into our program. And that was very interesting because then the rock music, the hip hop music, and the alternative genres from classical music and jazz really entered the music therapy. And when those musicians became music therapists, they went back out in the music industry scene in Bergen, and they made local pop-up jam sessions, occasions for patients to come in and play, and some of these initiatives are still running. So we have a very good ecology of yeah, you could say musical possibilities to participate in Bergen music scene. So that was a very nice thing that happened, and we hope that can continue. And I'm not sure that you have the similar in Oslo, Christine. Did you? Some of it maybe.
Yeah, I think it's in Oslo and in Norway in general, music therapy started with women working with children with special needs. And I think that's kind of the basis for both in Bergen and Oslo. But as you say, Viggo, the last 10 years, maybe it has developed a lot. And also here in Oslo, where the rock and the pop and the hip hop has got a bigger part of the education programs as well. And also the music therapy scene, or what I don't know what to call it, but the way we work has changed. And a lot because of the musicians in Bergen that I also learned from when I was a student. And well, I work in child welfare with adolescents, and I use a lot of pop and rock and hip hop, and a lot of songwriting and recording in studios, and having concerts and performances around. So it's very varied and way of working. It varies on the client.
This is of course not the only way we work. We have music therapy in rehabilitation and in other fields, but this movement that we talked about now, I think we can label that as community music therapy, which has made its kind of ground in the Norwegian music therapy landscape. And when we go out of the country, so to speak, to UK or the US, they are very interested in that aspect of music therapy, that music therapy can happen at the hospital and in transitions from the hospital to the local environment, and the music therapist can kind of be that supervisor or that person who helps the patients integrate back into his or her local environment. And yeah, as for now, that is very much called community music therapy. And yeah, but it's not the only way we work, but it has become a part of the way we teach the student to do music therapy. Wouldn't you agree on that, Johanna, or am I wrong?
I missed a little bit of it because my internet connection is not the best, apparently.
I
But
talked about community music therapy.
yeah, Bergen is the education in comparison, at least to other countries, I think it's very skewed toward community music therapy, sort of like that's the main perspective that we sort of learn, partially because of the expertise of our professors. So it's I think
Also a weak side, you mean?
when I first yeah, well, I don't know, expertise, weak side, isn't it all the same? When I went to a student conference in Denmark for the first time, I was really surprised how uncommon sort of community music therapy was in other places, and how it really gives people an opportunity to use it in wider contexts, and not just in tiny rooms, just people and people, and or just very almost clinical. It makes it more available, sort of, I think.
Great, thank you.
In our community in Bergen, we are discussing this because we have the performing arts at our institute as well. And the job market for musicians are very difficult. And being a musician, everyone knows that's hard. I tried it myself for 4 years. It was not very easy. So what we are discussing is that this new way of using music in the hospitals, in the elderly centers, and so on, what we actually see in the Dementia series, is new arenas for musicians to perform, to use their music, to make music valuable, and to make music relevant for our society in a sustainable way. We can put in some sustainability thinking into that pot. So yeah.
Thank you. Following that, actually, we are all conservatory or music academy people, most of us. And as music therapy is a pretty young discipline, it's also quite different from the traditional conservatory educations. I wonder how it works within the conservatory, how it fits in, and if you see any challenges. I know that we talk a lot about when we included jazz in the conservatories, and people older than me still talk a lot about the growing pains of that. So do you see any challenges? Maybe Gaute, would you like to start?
Well, first off, I would say one of the fundamental differences that I've discovered between music therapy and ordinary conservative education is that most of the teaching takes place in group settings in music therapy. We learn in groups, we talk in groups, and that's what I find to be a big difference. There's not too much, or compared to traditional performing arts degree of one-to-one. There is some, as Christine mentioned, with chord instruments and such, but mostly it takes place in a group setting. So that has its benefits. It means it's cheaper, but also it runs the risk that the department would like to increase the group size because it's cheaper to produce more students, and that's fine up till a point. Because a group can become too large for it to function properly in an educational setting. So that's something I think that if there are leaders wanting to implement music therapy, they should have this in mind, that there's an ideal group size in order for the teaching to be as effective and productive as possible.
I very much agree, Gaute, if I could supply. And I think also there are a lot of benefits in being in the Norwegian Academy of Music, because we are close to where the rest of the music education is. That being said, I would like to collaborate more and closer with with the rest of the academy, because I know when I was a student myself, we had a lot of informal meetings with the other programs, and that I learned so much from that, and I know that they learned a lot from us. And our way of thinking about using music and at an interpersonal level, and that's valuable for everyone. So I think everyone would benefit from more collaboration. And I know also that when our management and our principal, when they travel around in Europe, they always talk about the music therapy program with a lot of pride, and they also meet a lot of curiosity and interest and at the other academies when they talk about our programs. So I know that they're very, very proud to have them.
Do you feel like the rest of the academy is reluctant to this collaboration?
I think it's a matter of resources. We're all pressed for time. So I know that when there is time, there is collaboration. And sometimes we get invitations from forums in the for example, the pianists forum. We get invitations to talk about and do improvisation sessions with them. But there are a lot of time between these invitations, but we would like to, as I said, collaborate more, because I think it's valuable.
One way you can collaborate is to write each other into each other's applications.
For example,
our research center, Gamut, recently got NFR application funding, and in that application, the composition and jazz people were written into the applications text, so they helped us get the money, and we could think otherwise as well, writing music therapy into applications about performing arts and compositions, and in doing that you will naturally build bridges between the two fields, which is actually not separated at all, because music is music, and we are dealing with the same material, just in a little bit different ways.
So music therapy is music, but it's also health. And for example, in Bergen, you are part of a big university. Do you ever have conversations about what would happen if you put the music therapy in a different part of the university, like closer to medicine, or is that even something that is talked about?
It's talked about, yes, and as for now, we have good collaborations with the other faculties. We have great deal of projects that involves, for example, in the Faculty of Social Science and law, actually, and also medicine and psychology. What will happen in the future is difficult to say, but I think that we are well located where we are, and that we can stretch our arms out in the other faculties and collaborate. That's my personal view on this, but other people may have other meanings on this.
Yeah, also as like in the subjects, like as teachers or professors, we have at least one open subject where a professor from our neuroscientist from the medicine faculty comes and talks about music and the brain. We have a lot of visitors from psychologists or also, from the law department, I think even. It's very interconnected already. Like the medicine department is maybe the closest thing, and psychology is also very close. I mean, psychology is the next door building, so it's sort of physically interconnected. But I think we have almost more collaboration with the medicine.
Yeah, I would put social science faculty into that list as well. But it's very well functioning collaborations. through research projects, teaching, and also other activities. So this makes music therapy, at least in Bergen, a very hybrid. This hybrid character of the discipline is becoming more and more visible and functional level. Yeah.
So this is obviously going to be a lot harder to do in a music academy that is independent, and you don't have a psychology building next door. How does the Oslo gang experience this? Do you have enough collaboration with the outside world?
I'd say we don't have enough collaboration, but we do have a close collaboration with also medicine through the music and brain subjects that we also have here, with a neurologist called Are Brean that wrote a book with the person that teaches in Bergen. And also we have a close collaboration with the psychology department at the University of Oslo, where we have 2 psychologists coming in and teaching. So I would say we have a close relationship with those as well. And also the Department of Music, where some of our PhD students have collaborations with Institute of Music Institute of Music at the University of Oslo, where they collaborate in research. So yes, we should have more, but we have good collaborations, I would say.
I would like to put in a sentence about initiative that has made it possible for us to make this hybrid structure grow, and that is that our center has developed what we call a knowledge cluster called Polyphon. And Polyphon is a structure that helps us connect to the world outside, both the other disciplines, but also the professional life and the bureaucracy of health and care system, which is very difficult to collaborate with. So Polyphon, which is led by Professor Brynjulf Stige, is helping us a lot with that hybrid structure that we are seeing, and that has also made its way to Oslo, actually, because the Norwegian Academy of Music is part of Polyphon. So we are in very close collaboration with the Norwegian Academy of Music through Polyphon.
Thank you. Gaute, as a student in Oslo, you feel isolated by the academy, or do you have enough collaboration?
I think with collaboration, when you get it, you want more. I would always want more, but I stand by what Christina said. They invite lecturers, and we feel that we are part of something bigger. Yes, I would say.
And Gaute, could you see music therapy being at the university instead of the music academy?
Yeah, it is. That is the case in Bergen, but I don't think I wouldn't. It's not my place to say what would be better in Oslo. I think there's definitely a place for music therapy in a music academy, and there's also a place for it in the university. So, but I don't think maybe both places in the same city. I don't know. That might be a bit ambitious, but maybe we should.
Yeah.
So I think that these days the first group of music therapists educated in Norway are retiring soon, right?
Yes.
Or at least they're getting close to that age, and I feel like they have been a pretty strong voice talking about music academy music therapy in Norway. How do you see the future for the field? Like, how is it changing, and how is the generation that is educated now going to be different from this original group, so to speak? Big question.
Yeah, if I could start, I'd say that the first word that comes to my mind is growth. That we are growing, we are educating more people, and more people that also have a voice and that also use their voice in a very good way and very professional yeah, so I'm very proud of being a part of music therapy profession, and I think we're a lot of people with a lot of engagement and a lot of will to develop our profession, and to develop more positions for music therapists across the country, because it's no secret that the most of the positions for music therapists are in Bergen and in Oslo, and we need more positions in all of Norway, especially, as you said, Johanna, in the north, where there are very few still. But the ones who are there are very great musicians that we know, and music therapists that we know and we collaborate with. So we have a lot of great networks for music therapists, and those are important. So yeah, that was the first word that came to my mind, the growth.
Thank you. Anyone else wants to predict the future?
I leave that to you, Johanna. Do you have you are the future, aren't you? With the bad connection.
Well, I don't know. I think music therapy is maybe more established, and more established. Yes, it's not like super grounded yet, I think, but at least in comparison to what the first generation did, sort of, we have a network. We have a network. So it's still about network building, but it's also about really like supporting the already like built foundation. It's about doing research projects and getting it into like into directives and showing people that this is like a empirical field too. I think that's where we're headed.
I think that we are in a very peculiar situation, because some places music therapy is very much established, and the doctors and nurses, they know what it is. It's integrated into journal planning and systems and everything. But elsewhere, as Christine says, it's kind of, they don't know what it is, and those who want to, for example, move to Sortland or till Alta, they have to be pioneers and entrepreneurs and still build up their positions. Hopefully we can become more established even also in the north and also in the middle of Norway. But yeah, the only way to do that is to kind of continue the work, and we are also discussing if there are possibilities for even one more program in Norway. And could that, for example, be in Trondheim at NTNU? That may not necessarily be very dangerous for Oslo Bergen, but on the contrary, it could be helpful for us to have a third program in Bergen.
Thank you. Christina, short comment.
Yeah, I'd just like to add that part of this getting music therapy into the districts is here in Oslo, we have part-time education, both on the music and health program and the music therapy program, where you can go 50%, so half time, and we have 6 weeks each year with meetings and education through the year. So you take double time, but you become a music therapist, and you can live wherever in the country, just travel here sometimes during the year. So that's a very important way of working towards music therapy in the districts, I think.
Thank you. Gaute, would you like the last comment?
About what? I'd rather not finish everything, but
future of
yes.
Your generation is going to make the field look or change.
Well, I don't know. There was a big debate in our tiny world last year about pedagogical contexts or health contexts as a sort of attention. where were we coming from and where were we going? And I don't hope that tension will be resolved. I hope it will move with us into the future, and that we will be able to keep both these important contexts where music therapists are working going forward. But also health authorization, as we were talking about earlier, crucial.
Can I add to that?
Very briefly.
Gaute, because I think also that one very important subject that has been highlighted apart from the authorization is a specialist education program for music therapists. Because today, when you are finished with your 5-year or 2-year master program, there is only one way to kind of go for an advanced program, and that is to take a PhD. And we have a lot of PhDs on music therapy in Norway, but not everyone can go to a PhD. So we would like also to have a specialist education program for those who want to advance their knowledge and to become even more fit for example, the mental health work fields.
Thank you. Thank you for a great conversation. We are now going to open up for questions or comments. Comments or questions to a particular person or to the panel in general. If you like, you can write your questions in the chat also, or you can unmute yourself and ask them.
It was so clear.
Yeah, it looks like it was pretty clear.
Hi, so I would like to ask a question. I'm a music therapy student in Lithuania, and my question is regarding the neurologic music therapy, like specifically in Bergen. I know that there are not many neurologic music therapists, well, worldwide. So I just wonder how it is in Norway and in Bergen. Do you have like neurologic music therapists and or like anybody working in the neuro rehabilitation in the, you know, in the, not in the psychological sense, but using like rhythmic audio stimulation and techniques like that?
Yeah, I can try to, I'll take that one. And we have definitely music therapists in Bergen working within the field of rehabilitation and somatic illnesses. I know about 2 straight away now, and we use those music therapists as practice placement teachers. So our students can go there and get experiences with this type of music therapy that you are talking about. Saying that, I think that the neurological model of thinking music and the brain is not only relevant for rehabilitation, it's relevant for every field, because also when you are working in a school or a hospital or a prison, for that matter, the principles of how music affects the brains is also relevant for those fields as well. So in our program, you will have a introduction to this kind of thinking and to the principles of how music affects the brain. We have teachers coming in from medical settings to do those courses. So
Okay,
please come to Bergen, and we actually have a student from Lithuania now as an Erasmus Plus. But
yeah, I know.
visitor, and she can go all around and visit what she wants, and she tells me that she learns a lot.
Yeah, thank you. I will. I actually will try to come.
Yeah. Please come. Mm.
Thank you. Do we have any other questions or comments? Camilla?
Yes, I have a question. Thank you for a lovely conversation. It's been really, really interesting to listen to all of you. So in Denmark and increasingly in the Nordic countries in general, we're working with a term called artistic citizenship that's kind of growing and evolving more and more. And it's still maybe some would disagree, but to me at least, even though having worked quite a lot with it, it's still kind of a bit of a fluffy term. It can be many things. So I was just curious to hear you react to that term. Does it mean something to you? Is it even used in music therapy? And yeah, how do you see it, if you see it at all? Thank you.
I can try, but Christina, you are. I can see that you are reflecting.
Yeah, I'm reflecting. I don't know. What's it called? Artistic citizenship?
Yes.
Exactly.
Yeah. I don't know the term, but there are a lot of say fields like community music that touches upon and music pedagogy, of course, that touches upon music therapy, and there are gray zones between them, and also community music therapy that focus on community and the music in the community and bringing people back to the community. I think there are a lot of places where we touch upon, where we meet the same people, and I think it makes sense to know about your own musicianship, even though it's not music therapy. It's how to use music for your own good, for kind of self-therapy is very useful, and that you have a reflective relationship with your own musicality. So as Viggo said, we don't have music therapists are not the only people who can use music in a beneficial way. Everyone can use music, but we are very specialized in using music with very vulnerable groups of people.
Yeah, and if this term is mostly connected to community music, as I understand it, community music as a field is much bigger, for example, in the UK and elsewhere in Europe. So we also have a community music program located close to Bergen. So we don't see ourselves competing with community musicians, but we would like to collaborate with community musicians. And a part of community music therapy definitely has to do with community music, and the word citizenship and citizenship participation and so on are definitely concepts that we will use, but the artistic citizenship, not as, I don't know about it so far, but maybe in the future we can collaborate on that, maybe.
Sounds great.
Yeah, let's do it.
Thank you.
Do we have any other questions or comments? Okay, we have Wilhelmsen and then Kjell.
Yeah, just comment. And thank you for a presentation of Norwegian programs. And just I want to say hello for Brynjulf Stige and Gro Trondal and Tom Ness, and please say hello for just our friends. And as we say, Brynjulf Stige, I am as a mother pioneer in Lithuania, but Brynjulf was as a father, bringing us a lot of knowledge in the beginning, and then supporting our way. So
yes. That is great work that happened in the 20 years ago, something 15 years ago.
Yeah, we started in '97, but our music therapy program started in 2015. So we are really young.
Yeah.
But thank you, and we are looking forward for collaboration.
Yeah, and it's so great to have Katrina here now as an Erasmus student, and she contributes so much to our profession here.
Wonderful. Kjell, did you want to ask a question?
Well, maybe it's more a comment, but I also want to thank you for a very interesting discussion. I'm acting principal at the Royal Academy of Music in Denmark, and we have been, as Camilla just touched upon, we have been working on the concept of artistic citizenship, or kunstnerisk medborgerskab in Danish, for the last 4 or 5 years. And what you're talking about from the Norwegian perspective is very inspiring, I think, because maybe you don't use the concept, but that's what you do in reality. It is using art and connecting art and health and well-being in many different ways. And I like very much the approach that, yeah, let's work together, because it's not a competition. It's more about getting music therapy and performing arts closer together and finding ways of working together. I know it's a bit challenging in some of our countries, but I think you have found a good way to connect these two sectors in Norway. I think I appreciate that a lot. So thank you very much.
Thank you. And it's like someone said, it's enough suffering for all.
Yeah,
there's a lot of work to help all of those challenges in our times, and in Norway at least, the health problems are increasing enormously, and we are just helping a very tiny bit of the population. So if we can collaborate more, we can do more work.
Agreed.
I think there is enough suffering for all is a great way to end this talk.
Unfortunately.
Yes. So speaking of artistic citizenship, at the moment there's an ongoing project in ANMA which is called Next, which is about artistic citizenship. And you can actually find more talks about that on our ANMAtalks YouTube channel. So thank you so much to the panel, and thank you to everyone who listened. We will post, Camilla already posted a questionnaire about this talk that you can find the link to in the chat. So we would be very happy if you fill that out. And look out for more ANMAtalks. There will be a lot of interesting ones this spring. And yes, thank you. Let's give a virtual applause to our panel. Thank you so much.